In today's episode of Africa Health Check,
we've had to take studies online.
Wateja wale tunaamini kabisa na wale hao walienda kabisa na mnayo tujawaona mpaka leo.
We feature some African inspirational resilience stories.
This is livelihoods, this is everything, but I do understand where all this is coming from.
And rallying cries for reinvention during this pandemic era. Hello, good day, and welcome to Africa Health Check. I am your host, Hohontlejang Paladi. This show aims to showcase the impact of COVID-19 on various socioeconomic aspects on the continent of Africa. We set out to dissect the pandemic's effects on household incomes and poverty on the continent, as well as shine a spotlight on the resilience of the African people. Join us on this journey as we hear from experts from various regions across the continent on insights and personal stories on how COVID-19 has affected lives as well as livelihoods. Against all odds, as Africans, we have indeed survived and shall continue to thrive. To kickstart this show, let us have a look at the week in numbers. This week, our Africa in Numbers segment looks at the latest updates from the Africa CDC on progress made in COVID-19 vaccinations on the continent. Collectively, the continent vaccination rate is currently at 10.6% on partial vaccinations and 7% for the fully vaccinated. Looking at the top 5 nations based on their fully vaccinated numbers, we see that right there at the very top is Seychelles leading with 71.09% of their citizens being fully vaccinated. Mauritius follows swiftly at 68.73%, Morocco at 61.43%, Lesotho at 33.88%, and wrapping up the top 5 is Tunisia at 33.72%. And that is our week in numbers. In today's show, we will be discussing resilience stories, reinvention and innovation during COVID-19 era. Joining me in this discussion is Dr. Marianne Moreithi, the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya. Also joining us is Reverend Anthony Achampong from Ghana, who's a pharmacist and a pastor. Last but not least, we are joined by Mr. Kenneth Mutsidisi Stimela, founder and managing director of Leverage Point. Before we dive into the discussion with these amazing panelists, I want us to get the ball rolling, so let us watch a feature from a young Pan-African trendsetter, Roy Washira, who will be sharing his resilience story.
Hi, my name is Roy Washira. I am an entrepreneur. I focus on hospitality, events, and media. We just started this restaurant 2 years ago, 2 years before COVID, that is. So Kaya is my daughter. So Ikaya is home in Kosa. So I wanted a place where that felt like home. Pre-COVID, that one of our biggest hustles was definitely that events were just starting out and trying to get it to go. As COVID was dawning, obviously it affected a lot of our what we would call our core businesses, which is the event world was shut down. For the restaurant scene, things were really, really changing. There was a lot of laws that had come in that weren't favorable for the restaurant industry. Actually, I remember I just come from getting my first vaccine, and then the announcement had been made that we have to shut down again.
2 years, then now we have to close again. So tired of just feeling what I'm feeling. This is livelihoods, this is everything, but I do understand where all this is coming from, but I'm just I am not going to not say I'm sad. And this is gonna, it hurts. Like, it really does hurt. Like, to see all this happen overnight. Anyway, we'll figure something out.
I think the video was well received, and it was received in different ways. For the people in business, they understood what I felt. They've been dealing with the pain of having to shut down or endure some sort of suffering in their business. A lot of people discussed, and I think also pressure towards the government to figure out how to implement things in a much more friendlier way that just doesn't have a blanket approach to everything. When it comes down to digitization, we've had to sign up to numerous platforms, all the home delivery platforms, so that we can be able to deliver. Not all restaurants can sell everything about the experience of coming to the restaurant in a takeaway package. You can't sell the experience of being inside the space. So that's one thing obviously customers miss out on when they do home deliveries. But even for us, we'd had to accept that we'd rather be selling than not selling. It's been really tough on a lot of people. You gotta keep on pushing. You have to figure out how to utilize all the resources you have in your hands. Just know you're not fighting alone, because we're all in this fight.
Wow, such a really moving and touching story of resilience and endurance against all odds. I believe we have been motivated and challenged by Roy's story. Thank you so much for sharing it with us, and please keep up the great work. I'm going to now move to my panelists for today, and I think somebody who shares a lot in common with Roy Washira is our entrepreneur on the panel today, Mr. Motsidisi. I'm going to start with you. Hi, Kenneth.
Hi, Hohondre. How are you?
I'm good. How are you, Motsidisi? Maybe let's just start off here. Who is Motsidisi and what do you do?
Motsidisi Kenneth Sitimela is a son to Botswana and a diplomat of Africa. I'm currently trading my software skill and taking my company to Africa. I'm a founder and managing director of a software development company called Leverage Point that is based in Botswana, and that continues to be growing in the rest of Africa. We currently have presence in Malawi at the moment, and we are continuing to take our solution called Business Point that is developed to digitize and assist SMMEs in terms of overall automating their business processes.
So you are basically the tech guy in Africa, and I know that technology is one of the industries that saw a big boom during the COVID-19 pandemic. So maybe you can just share with us what is the work that you have been doing to ensure resilience in your line of work and for your business as well.
Thank you, Hohondre. We find ourselves as a very innovative company. And at the height of the pandemic, one of the major projects that we undertook was the Botswana Travel and Tourism Virtual Expo, which was for purposes of assisting the tourism sector in terms of us providing them with a platform that allowed many other exhibitors around the country, as well as international agents, to have business-to-business meetings. This software solution was used across 30 different countries, starting from Australia all the way to Brazil. And the purpose of it was to assist the tourism sector when it was at its knees, to keep it vibrant, to sell the product, and to continue informing the rest of the world about the packages that are available in Botswana in as far as tourism is concerned.
Wow, this is fantastic. Thank you so much for sharing that. I'm going to now move to Dr. Marianne, who's a medical researcher. And maybe just to ask you, Dr. Marianne, what has resilience been like in your line of work?
Thank you very much. And it's great to be in this panel and talk about the resilience. in my sector. So as a short background, I'm a medical researcher and I spend a lot of time in the lab, a lot of time with communities trying to understand disease patterns around the community setting. And with that, the pandemic came at a point where we're really critically looking at viruses. What virus can cause an infection? When can it cause the infection? And we're actually anticipating a pandemic. We did not know which pandemic was coming, so we were calling it the disease X. And WHO had been speaking about there's a pandemic coming. Are we ready? But when this pandemic or this virus hit us on the ground, it really tested our capabilities of detection, our capabilities of surveillance, our capability of sending information real time to our government and policymakers to tell them and to warn them what we are facing, what we should do, and how to prepare the communities. And I believe the resilience within our sector is that we had already created structures. We were able to work as a team, as one team, with policymakers, with our communities, with government, trying to advise them we need to wear masks. This virus is a respiratory tract virus, so we need to be able to wash our hands, wear masks, social distance, and this message was being passed to our communities in real time. Yes, we got a lot of resistance for people who are probably not very well versed on how diseases spread, but constant communication. We learned how to constantly communicate, break down our science into very simple language and communicate better. And I believe this really showcased Africa, that Africa can face any type of infection. And with that, we can be able to somehow outpace the virus and see if we can keep up with the global community in terms of research, in terms of vaccine availability, etc.
Thank you so much, Dr. Marian, and we really appreciate your service and all your efforts. I believe that the negative impact of COVID could have been worse had we not had people like yourself who are experts, well-trained, to be at the forefront of researching around this pandemic that was sort of a shock to everyone, the whole worldwide. But I think the frontliners have done their best to ensure that we reduce the negative effects or impact of this pandemic. I'm going to now jump to the religious sphere, and we have Reverend Anthony with us. And maybe just ask Reverend Anthony, what does resilience mean in your line of work as a pastor, but also as a pharmacist?
Well, we all know that COVID descended upon the world, and there was much hysteria, fear about the impact. And then with the announcement that not less than 10 million of Africans will perish with this virus, put everybody on alert, the government, communities, as well as the church. In my church, and I know for certain that many other churches took education very seriously with the proven research, social distancing, washing of hands, applying sanitizers, face masks, and then a strict rule of sanitation in the church premises and the communities. Africans, especially Ghanaians, are kinship oriented. It's community-based support for one another. So in my area, it was more of helping people to stay alive in spite of the news that were going around, and innovation. People had their own traditional means of doing preventive medications, and so it's quite a surprise. And I cannot dismiss faith. People who flock to churches just to pray, to keep themselves and their hopes in God. And I do believe that somewhere along the line, it has worked. The question is it by chance, or they were concerted efforts put into place by government and the community? And this is where I believe these discussions will make it life.
Absolutely great. Thank you so much for that, Reverend. You know, the truth is that the role of a religious community in Africa, it has always been important historically in issues of nation building and development, and it's always good to see the religious community also taking up their social responsibilities in responding to matters such as the pandemic. So thank you so much for the work that your church is doing in Ghana, and I'm sure these are sentiments that are shared by other religious communities across Africa. I'm going to quickly circle back to Mutsidisi. You know, Dr. Mary Ann was talking about the innovations and inventions that needed to be done around the COVID era, or in response to the pandemic, you know, because we needed to be agile and just develop as the pandemic was continuing. So I wanted to just find out what are some of the innovations that Leverage Point, your company, has made relating to health in most recent months.
Thank you, Horontle. We always pride ourselves with being in the forefront of innovation in as far as Leverage Point is concerned. And we are quite agile in terms of coming up with solutions that are specific to the current issues at that particular time. I spoke about Virtual Point, a software solution that we developed at the height of the COVID pandemic to address the fact that people could not meet in one area. But in the health space, we've come up with a product that we call Health Point, and it's a software solution that we have been promoting for the health sector, particularly to assist doctors around billing, around ensuring that patient records are available to them, and most importantly, to be proactive in terms of the assistance that they are giving to their patients. One of the main challenges that are there, particularly in Africa, has always been that patient records are not immediately available electronically. And you find a situation where one person could be hopping from one doctor to the other, or even coming to the same doctor and being diagnosed and given the same without looking at their history and as far as the patient is concerned. So we've been coming up with these software solutions to allow doctors to concentrate more on assisting in a strategic way rather than having to deal with the administrative part. So somebody comes to a clinic and that they're able to be assisted and have patient records, again, subject to security processes that come with the patient records. That's what we've been doing.
Fantastic. Thank you so much for that, Mutsidisi. I think there's so many things that we can talk about when talking about resilience in Africa, but we're going to do a little bit more of that after the break.
We had to come up with new ways of working, so we would do work. People are working from home several days, other days they would come to work, so we had to adjust, especially when the government said we close schools and things like that.
Limepunguza kipato, alafu pili limeleta uoga, kwa sababu unapozungumza kitu kama hicho, mfano wajua biashara sasa hivi za kutegemeana. Mimi nikana nikafanya biashara, lakini biashara nikamtegemea mwenzangu. Huyo mwenzangu nimtegemea iza dada ni bosi, anategemea labda asafiri, akachukue mizigo. Sasa na wakati huo wakati ugonjwa umepamba, mipaka imezuiliwa, ameambiwa hakuna mtu kuingia, hakuna mtu kutoka. Kwa vile vile imeniathiri pamoja na familia yangu, kwa sababisha hali ya maisha kuwa mbaya.
Coronavirus made me to be chased away from my job, so I lost a job during that time. It has also affected me because when I lost a job, I didn't have any money, so I couldn't make my family to raise them up. Couldn't raise them up by that time.
Very interesting views. Thank you for everyone who managed to share their views on what resilience has been like for them in the face of adversity, in the face of the COVID-19 pandemic. Indeed, as Africans, we are such warriors and we are bound to survive and thrive. I'm going to go back to my panel now and just sort of wind down on our discussions. Just before we went for a break, Motsidisi was talking about the health point innovation, and I just wanted to ask him, you know, we're talking about resilience and it's all good and wonderful, but I want to ask him, what are the challenges that as young entrepreneurs in Africa they face when they come up with these innovations and they need them to be taken up?
I always talk about innovation on the basis of three elements, which is the people, the processes, and the technology. But whenever I have to talk about innovation, particularly with Africa, I always like bringing in the cultural element. I think this is what makes us different in terms of the solutions that we are able to do. What we are able to do in Africa is different from what is able to be done in so many different continents. And the challenges of Africa are the ones that need us as Africans to be able to be in the forefront of solving them. What I would tell to young innovators is, look behind you, where you come from, your background. That is where the problems that need to be solved. And when you fuse that with people, processes, and the technology, you are bound to be sitting on gold and diamonds.
Absolutely fantastic, and a really motivating and inspiring message from Motsidisi. I'm going to now move to Dr. Marianne. Marianne, we were talking about the wonderful things that have had to be done over the last couple of months to respond to COVID-19. From your field, what would you say still needs to be done to build more resilience towards the pandemic?
Thank you, and it's great to hear the innovations. So from my point of view, in terms of innovation that we critically need from the health sector, is to come up with our home-based solutions. You know, when you give a community solutions that are African-based, home-based, they can connect and relate with them. And you know, one of the biggest problems we have right now is vaccine hesitancy. Have they been tested on African? And if they have, what were the results? And how we are trying to bridge that is in that we are collaborating and working hand in hand with pharmaceutical companies, Pfizer, AstraZeneca. In fact, our center, we were part of the team that tested the AstraZeneca vaccine within our African countries, within our Black populations, or African population, because we wanted to prove that we are also eliciting immune responses. We are responding and responding in the right way with these vaccines. So having home-based solutions, and I'm really happy to hear what Kenneth and his team is doing, will make our products more trusted, tested, and also easier to sell, and also pass the message on that vaccines are safe in terms of our innovations, and they're saving lives. So I could talk on and on other things that we're doing in terms of innovation, but the key thing here is vaccines and saving lives and livelihoods.
Absolutely great. Homegrown solutions for Africans by Africans. I absolutely love that. And now we're going to go to Reverend Anthony. What would you say needs to happen to ensure that we build more resilience, especially spiritually and morally, as a society, as a community in Africa?
What I would say is that against all odds, Africa has beaten, all the predictions about deaths and so on and so forth. So then my recommendations would be that whatever good things we are doing, to stay the numbers low. I mean, 3.6% global cases, all Africa, 3.6% of all COVID deaths, Africa. Africa must be doing something good. And my recommendations would be that whatever good things we are doing, let's keep on doing, especially in the churches. Keep on with the education. Keep on enforcing the social distancing, the face masks, and so on and so forth. And of course, also prayer, because the average African believes in prayer. So our and the community support, the government support, giving free things to people just to back them up is phenomenal. That's what I would say, because our ability to withstand and to come back from this virus is something that I believe African has been able to do very well. So let us keep on doing the right things, the good things we are already doing, and we'll be able to stay the numbers down.
Absolutely true. You know, the religious community in Africa, they are gatekeepers of our society, and you are also custodians of the moral fiber. So your involvement is really important. You know, there are many people who actually listen to something, not because a government leader said it, but because my pastor, my reverend, my imam said it, you know. So that is really important. Reverend Anthony, we're just left with about under 2 minutes, but I wanted you each to just answer something very, very quickly, and I'm going to put you on the spot with this. We've had a really gloomy, dark, and sort of like morose almost 2 years, you know, and so many people were thinking, is this the end of the world or not? I want you in just 30 seconds to tell me what kept you moving. What is that thing that gave you hope, optimism, that kept on saying, you know what, we are going to overcome this? So just 30 seconds, tell me what is that one thing that kept you hopeful and still pushing against all odds, against losing so many loved ones. I'm going to start with the Reverend Anthony. Your 30 seconds starts now.
Personally, it's God. I behind everything I do, and for most Africans, it's God. So let us take the vaccines. Let us wash our hands. Let us put on the face masks. But the fear of God and the willingness and the readiness to live gives people a sense of hope against all odds. That's what I would say.
Absolutely. God. Thank you very much. Dr. Marianne?
Yes, of course, God, and that's encouraging to hear. But for me personally, in addition to God, is I'm a curious person, and I've studied viruses for many years. And you know, one key with viruses is always a weak spot. There's always a way that God has given us the ability to study these viruses and to identify the weak spot. And that's why right now we have vaccines, and many more are coming. We also have antivirals, and this is again God-given ability to be able to study these things, study viruses, create solutions, give them to people, and save lives and livelihoods.
Absolutely. So for you, it was the thought of being part of the solution and triggering your professional side, and that's absolutely fantastic. And Mutsidisi, your 30 seconds. What kept you moving in the last almost 2 years?
I think it's gratitude for me. I wake up every day and be grateful for the moment. And every day, by the way, my name, Mutsidisi, is in itself somebody who gives life. So it's the gratitude that I have and the belief that I have finally found my purpose, which is basically to use my digital skills to impart knowledge.
Absolutely great. So gratitude kept you moving. You know what? We could spend the whole day talking about this, your beautiful stories and experiences, but we have really come to the end of our discussion. I want to thank you, Mutsidisi, Dr. Marianne, as well as the Reverend Anthony, for taking time to come and share with us your resilience stories, but also inspiring Africa on how we can even build better resilience towards overcoming this pandemic. No time will ever be enough to discuss the stories of resilience in Africa in the face of a pandemic that threatened our livelihoods. But today, we got to share some of those stories, and I hope you have been inspired, and most importantly, you have been challenged. Remember to share, follow us on social media to keep engaged. Tune in for the next episode next week, same time, same place. Until then, the future is Africa, the future is today.